Today I'm going to be doing an assessment on the musculoskeletal system. I'm going to start by checking, inspecting the area, and then I'm going to palpate the temporomandibular joint, checking for any warmth, um, any tenderness or pain. Do you feel any tenderness or pain?
No.
All right, I'm going to ask you to open and close. Open and bite down. This will help me test for strength in the joint. Now, I will step back and I'm going to check the shoulders, and I'm going to inspect for symmetry, see if there's any elevation from one side to the next. This will be indicative of scoliosis. All right. Next, I'm going to palpate the acromial clavicular joint, and it's the joint in the shoulder muscle. I'm going to palpate around, down, and on top. Next, I'm going to check for range of motion. I'm going to ask you to open up your arms this way. This is abduction, and bring it down. That's adduction. All right. Then you're going to bring it forward. This is flexion above your head flexion. We're going to bring it down. Now we're going to test for strength of these muscles. Push out, in, extend your arms, up, down, in, out. Now we have checked for the strength of the shoulder. Now we're going to move down to the elbows. Here on the lateral, we have the epicondyle joints. Here's your lateral aspect and the medial. We will palpate both sides. We will also check the elbow for palpating around any tenderness, swelling. If you notice fluid, warmth, or redness, that'll be indicative for bursitis. When we check lateral aspects, any swelling, that will be considered tennis elbow. Any on the medial aspect is golfer's elbow. Now we will move down to the wrist. We will continue to palpate the wrist. Any tenderness or pain in your wrist?
No.
We will check the side because we want to check for a carpal tunnel. We will do the Tinel's test, or I will tap on the wrist. Any numbness, pain?
No.
Okay. If there was numbness, pain, or tingling, this would be indicative of carpal tunnel. Now, I am going to ask you to test the, we're going to test the muscles and the range of motion and the strength of the elbows and wrists. You're going to make a fist like this, all right, and push and pull. For range of motion, I'm going to ask you to bring your hand to your mouth, each hand. Start at the bottom and bring it forward. And now we are working the range of motion with the elbows and wrists. Now I will move down to the fingers. We will check each joint separately. We're looking for any redness, deformity, swelling. This will be indicative of arthritis in the hands. All right. Do you feel anything? Pain, tenderness? All right.
No.
Now that we have finished the upper body, we're going to move to the lower body. I'm going to ask you to lay down. We will allow the patients to have enough privacy, so you will ask on examination, were there any lesions, or have you noticed anything different around the hips?
No.
So we will skip the inspection and palpating of the hips. Right now I'm going to check strength and range of motion of the hips. So we're going to place on your knees, hand on the knee and the other hand on the ankle. I'm going to ask you to push your knee towards your head, push, and push towards my feet, my hands. All right. So now I'm going to check internal and external rotation. We're going to external and internal. And we're gonna put this back down. And you can do this on both sides to check for range of motion. I'm gonna ask you to sit back up. Next part, I am going to check the knees. So I would be sitting down for the knees. So for the knees, we will palpate. We will inspect the knees, see if there's any deformity and any shifting going on, and we'll palpate above and around and below, and we will push on the patella itself. This would be indicative if there were any cartilage fractures or anything going on at the patella. Next, I will check the ankle. I will start in the back, check the Achilles tendon, continue to palpate forward to the anterior aspect. You have any tenderness or pain?
No.
No. I am going to check the muscle strength and range of motion. I'm going to ask you to rotate your ankles, please. All right. Now we're going to check for strength. Push against and pull. All right. Very good. That will be the end of the musculoskeletal system. Thank you.